Hi, my name is Liz and I'm the infant feeding lead for Ashford and St Peter's Hospital. You'll be watching this because either you're pregnant or you're at high risk of delivering your baby prematurely, or perhaps your baby has already been born and has been transferred to NICU. Either way, we strongly advise and ask that you express your milk and your colostrum for your baby because it is full of antibodies that will protect your baby against infections. It's also tailor-made for your baby, so if you deliver prematurely, the milk that you produce is tailor-made for the gestation that you've delivered your baby at. It's also very easily digested, and sick and premature babies have got very fragile guts, and we need to protect those guts. And breast milk, mother's own breast milk, is researched to be the most effective at protecting newborns' guts against infection. So when you are admitted to hospital, hopefully you will be given a pack that looks like this. This is a Milker's Medicine pack. And inside that pack, you will get an information booklet that looks like this. Inside the booklet, it talks about the benefits of colostrum, and it also talks about the fact that even if you're planning to bottle feed your baby later on, we still really advocate and ask that you express milk for your baby from birth, preferably a little bit antenatally as well if there's time, but definitely from birth for the duration that your baby is in NICU. If you're wanting to introduce formula later, it becomes safer to do so from about 34 weeks, and we can support you to do that. But if you're planning on breastfeeding your baby long term, it's a really beautiful and gradual progression from 28 weeks when the baby can latch onto a recently expressed breast, all the way through to responsibly breastfeeding when they're discharged home. And I'm here to support you through that journey. So we can talk you through hand expressing, using a breast pump. It's all in this leaflet, but I will talk you through some of those skills. And in this leaflet as well, there's a section on donated breast milk. So we know that colostrum comes in very tiny quantities. It comes in a ml or less. Some people just are able to express the tiniest tip, fill up the tiniest tip on the syringe, and every drop is fantastic. We're delighted with every drop that you produce, and it's really protective for your baby. But there will be a small gap between us starting to feed your baby and your milk coming in. And so we often will support your milk and supplement it with donated breast milk, and your paediatrician will be able to talk to you a little bit more about that. But there's a lot of information on that in your booklet. It's very safe and it's pasteurised and the women are screened, and we're very lucky to have a bank of donated breast milk in our hospital. Talks to you about how to keep your kits clean, which we will discuss. And it's also got an expressing log at the back. This is really useful, and I'll be talking to you a little bit more about that in this session as well. In your packs, you will have some syringes, and this is to collect your colostrum, and you will also have some labels. And what we ask is that when you express your milk or your colostrum, you fill in a label with your name and the time and date that you expressed it, and you attach it onto the syringe, and then you put your syringe back in its plastic wrapper, keeping it as clean as you can. Always make sure you wash your hands before you express. Keep your milk as clean as possible, and then you give that to your midwife. If you've expressed this milk antenatally, then it can be kept in the fridge until your baby is born. If you've expressed this milk after your baby is born, it can be given to your baby straight away. So give it to your midwife to transfer to your baby's cot side on NICU, and we can give that immediately to your baby. We feed babies every 2 hours on NICU, so every drop that you give, we'll give to your baby, and the fresher the better. So we do ask that if it's possible to start collecting your colostrum antenatally. It's not possible for women. There has to be a real weigh up of risks of increasing the premature labour and collecting the milk for the baby. So you need to talk to your midwife and your obstetric team about what the risk factors are for you. But if it's possible to collect some colostrum before you go into labour, you know it's ready to give. So as soon as your baby's born, they'll go to NICU with the milk and they'll get it straight away. And what we're aiming for is to give every baby who's admitted to NICU their own mother's breast milk within 2 hours of birth. That's our gold standard. If it's not possible, don't worry. As soon as it's possible after birth, and preferably within 2 hours of birth, again, that's not the case for all women, we would help you do hand expressing and using a breast pump after you have given birth. The hand expressing, as we know, collects the colostrum, and I'll be showing you how to do that. But we do recommend you use a breast pump as well, because although the breast pump doesn't collect the colostrum as well, it fires up all those receptor cells, which brings your milk in a timely manner. So on a normal breastfeeding journey, your milk would come in between days 2 and 4. But for some women, if they've had complicated deliveries or they've lost a lot of blood, it can be delayed up to 7 to 10 days. And if you deliver prematurely, your breasts haven't gone through that final bit of maturing. And so to use a breast pump from birth on a sensitive setting really brings that milk in, and it also increases the volume of milk that you're able to produce long term. So let's talk about hand expressing. To hand express, you need to first of all do some massage. What we're doing is we're releasing the oxytocin, those happy hormones, and the oxytocin really helps with milk production. So you're going to start by doing massage all around your breast. Go towards the nipple. Some people like to use a circular motion. Some people like to use a stroking motion, but the important thing is that you're gentle. Don't go dragging your skin. Make sure you're nice and gentle. You're waking your breasts up. Okay, so all the way around, working towards the nipple. You then want to make a C shape. Use your thumb and your finger, and you're feeling for a ridge, which is just behind the areola, which is the darker part of your breast. So it's normally a couple of centimetres back from the nipple, but you're feeling for a slight change in texture. When you've found it, you need to use your thumb and finger and press them towards each other. And you go in a rhythmic motion like this. You don't want to again drag your skin and make yourself sore. You keep your fingers in one place and you press them together. For some women, it's easier to go back towards the rib cage and bring your fingers forwards as you bring them together. But have a little try for yourself and see what works for you. What you'll start to see is some little glistens of a serous, translucent substance that come onto your nipple, and that's your colostrum. And you start producing your colostrum from 16 weeks gestation. It is packed full of antibodies and sugars, which is all that your baby needs when they are first born. Okay, so you really, really, really good to collect it. So you've got ducts all the way around your breast. So you might start at 6 and 12 o'clock, but you can then move to 3 and 9 o'clock. You've also got 10 and 4 o'clock, and don't forget you've got 2 and 8 o'clock. So you're working all the way around your breast and you're covering all of those ducts. You may find that you have quite a lot. You may find that you have nothing at all. If you have nothing, don't worry. It is there and it might just take a bit of time to bring it down. So each day, you do it every couple of hours, you give it another go, and especially combined with the pumping after you've given birth, you'll really bring that milk in nice and quickly. Okay, so don't forget you've got 2 breasts, so you do both breasts. If you have collected your colostrum before birth, make sure you've given it to your midwife to put in the fridge. And if you've collected your colostrum afterwards, don't forget it can go to your baby straight away. I'll be talking about pumping in the next video.